Culturally competent nursing care for Native Americans. Native Americans, also known as American Indians and First Nation peoples, are people of ancestry from the indigenous inhabitants of North and South America, and include a wide diversity of ethnic and tribal groups, such as the Inuit, the Cherokee, the Iroquois, the Navajo, the Shoshone, the Maya, and more. When caring for a Native American patient, ask if he or she has cultural or religious considerations to healthcare. Many Native Americans speak English as their primary language, but many try to keep their indigenous languages alive and as a key part of their culture. Examples of Native American languages include Navajo, Cherokee, Cree, and Zuni. Use a certified interpreter to communicate with patients who do not know English, or if English is not their primary language. Various religious traditions can be found being practiced amongst the Native American community. While many have adopted Christianity, there are Native Americans that have continued to practice their own indigenous religious traditions, which include shamanism and the veneration of nature spirits. Most Native Americans follow the holistic health model of understanding health and illness. According to the holistic health model, an individual is composed of the individual's body, mind, social life, and spiritual life, and illness is the result of imbalance of the patient's physical, mental, social, and spiritual needs. However, there may be some Native American patients that follow the magico-religious health model, which claims that health and illness are controlled by supernatural forces, such as the will of God or magic. There are several cultural-bound syndromes that can be observed in the mental health of the Native American community. An example of these include ghost sickness, a Navajo culture-bound syndrome, which is characterized by dyspnea, body weakness, and nightmares, and is believed to be caused by an evil spirit that must be exorcised by a shaman. Key elements of Native American culture include living in harmony with other people and the natural world, respect for the elderly and children, respect for all living things, and the preservation of their cultural and spiritual traditions. Many Native Americans practice traditional Native American healing, which includes the use of a shaman who is believed to be able to travel to the spirit world to find answers to various problems, ceremonial song and dance, sweat baths, and herbal remedies. Traditional healing practices vary from tribe to tribe, and the nurse should ask the patient if he or she uses herbal treatments to determine possible drug contraindications. Diseases and psychological disorders that are common among Native Americans include alcoholism, depression, hypothyroidism, hypertension, glaucoma, rheumatoid arthritis, and osteoarthritis. Each Native American tribe has its own culture and traditions that may affect how healthcare and illness are viewed. For example, the Cherokee Indians believe that pregnant women should not wear anything around the neck, or eat squirrel, speckled trout, or rabbit during the pregnancy. Ask your patient for specific cultural beliefs and values that play a role in healthcare. Avoid using Native American stereotypes, such as all Native Americans practice shamanism, or that all Native Americans live on Indian reservations.